Thanks for watching On Call for All Kids. Today we're talking about attention deficit hyperactivity disorder, or ADHD. We'll talk about common characteristics of a child with ADHD, what to do if you're a parent with concerns about your child's behavior, and how to be an advocate if your child receives an ADHD diagnosis. I am joined by Dr. Jennifer Katzenstein. She's the co-director for the Center for Behavioral Health at Johns Hopkins All-Children's Hospital. Happy to see you, Dr. Katz. How are you?
Good. How are you, Ashley? It's a pleasure to be with you today, as always.
Doing great. And this is such a wonderful topic because as a parent, you might have some concerns about how your child is doing in school and maybe think, hey, there's attention issues. Do they have ADD or ADHD? But let's break it down. What is ADHD?
So ADHD, or if we spell it out, attention deficit hyperactivity disorder, is a disorder which impacts attention. Sometimes kids can also have difficulties with activity level or be impulsive, and maybe even difficulties with organization and planning. But the hallmark feature really is that inattention, distractibility, difficulties concentrating, and it's impacting daily functioning. It's impacting their work at home, at school, and how they have friendships potentially as well. In order to make the diagnosis, which really is interesting, you have to have these difficulties in 2 or more environments. So not just at home or not just at school, but in 2 or more environments.
So, Dr. K, I even said ADD before because that's something that was used before, but technically it's ADHD now. Can you kind of explain that?
Absolutely. So with the newest diagnostic manual that we use to make diagnoses, it is the Diagnostic and Statistical Manual, 5th edition. ADHD became a spectrum of diagnoses to encompass all of those subtypes. So what we used to call attention deficit disorder, or ADD, became ADHD predominantly inattentive presentation. So underneath that ADHD spectrum, really we're working to look through the subtypes to talk about, is it hyperactivity, impulsivity, and inattention, the combined presentation, just the inattentive presentation, which we used to call ADD, and like I said, now is ADHD predominantly inattentive presentation, or potentially our attention is pretty good and we're having more difficulties with hyperactivity and impulsivity. And so then we have the ADHD predominantly hyperactive impulsive presentation. So there's multiple different subtypes underneath that ADHD umbrella.
As a parent, what do I do if I have some concerns? How do you move forward with diagnosis to figure out what's going on?
If you have concerns, a really great place to start is with your child's teacher or teachers to see what their concerns are. What are they seeing in the classroom? Your next step is to check in with your pediatrician, who is able to do measures for both you and the teachers in order to determine if a diagnosis is appropriate. But if there are more factors impacting symptoms, or if the pediatrician wants more information, or if things are a little bit more complicated, especially with virtual schooling and maybe seeing a change in mood, anxiety, or stress during this time, then a psychologist or a neuropsychologist might get involved.
What are the treatments for ADHD? Is it always going to be medication?
So there really are 3 main components that we know are the most effective treatment for ADHD based upon a really huge database of literature. One are home interventions. The second piece of the puzzle is school accommodations and supports. And then the third piece is really that potential for medication management as well. We know we have a great array of medications that can be effective for many kids for ADHD, but that is always a family decision, because we also know that we can have great home behavioral interventions and educational or school accommodations that can manage everything as well.
Well, you mentioned school, Dr. K. So how can I be an advocate for my child and make sure they get the school services that they really need?
Absolutely. So definitely, again, starting with the teacher is a really important component. Find out what the teacher is seeing, and then talking with the teacher. One of the things you may be talking about with the school system or with the school district is starting some type of educational plan, either a Section 504 plan or what we call an IEP, an individual education plan. So your teacher will know who within that particular school is the best contact to discuss how to start those processes. A great way as a parent to initiate this is to put your request in writing and turn it into that individual that the teacher tells you. Sometimes it's the principal, sometimes it's a school counselor, sometimes there's the head of exceptional student education or ESE services. So get that in writing, and then the school will be able to respond and work through the next steps.
And what about at home? What are some of the best things that I could do to support my child with ADHD?
There's a couple of great things. We've talked before about behavior charts and using a technique such as a button jar or a stone jar or a sticker chart to really catch that good behavior, set a few really clear expectations or chores for the day that we're giving rewards for. Another thing, especially during homework time for kids with ADHD, is taking frequent breaks. So setting a timer, getting through a certain amount of work during that time, and then taking a break with lots of opportunities during that break time for either some physical play or some relaxation with meditation or deep breathing, so that our kids are really breaking their attention down into manageable components when they really need to focus in. In addition, keep those expectations consistent. Make sure kids know what the rules are, and then give lots and lots of praise and positive reinforcement when we, again, are catching our kids being good.
What else should we be looking for?
Yeah, especially when kids have difficulties with attention, this can lead to difficulties with learning as well. So we really do want to monitor how much information they're acquiring in the classroom. We also want to monitor anxiety and depression, because the frustration with not being able to pay attention or increased difficulties with school can really impact anxiety, mood, and that self-esteem, especially surrounding school. And then monitoring what we call executive functioning skills. Those are the skills that we need to keep ourselves organized, plan things appropriately, manage our time well, multitasking, as kids with ADHD can sometimes have difficulties with executive functioning and need support in these areas too.
Lastly, what does the future look like for my child if they have ADHD?
Yeah, this is a question I get asked all the time. The future is really bright. We know we have great treatments for ADHD. We can do that holistic approach with home and school and maybe medication. And our kids with ADHD have this creativity and amazing personality characteristics and social skills that really do serve them so well. So we want to make sure our kids are getting everything that they need, because it's that creativity and ingenuity that we need more and more of.
Well, Dr. Kassenstein, thank you so much for joining us today and telling us all about ADHD and how we approach that as parents.
Thank you, Ashley.
And thank you all so much for joining us today. Don't forget, you can also check out our website. It's hopkinsallchildren's.org/newsroom. You'll find a lot of other timely topics in pediatric healthcare and other resources that will benefit your family as well. We'll see you next week.